I was at work, I had a just severe stomach ache, and I knew I had to get feeling better because we had tickets to the Big Ten title game in Indianapolis, so wanted to get feeling better, so I left work a little bit early, went home, tried to rest.
So finally at about 8 o'clock he said, "I think we need to go to the hospital, something's really wrong."
My body just wasn't responding, I was getting sick, couldn't hold any liquids down. I remember going in there and I couldn't even sit up, there was so much pain, and they took me back into a room, they did some blood work, and
the doctor comes in and is like, "You have pancreatitis."
Nothing seemed normal to me, and it started messing with my head. I know I tried to escape a couple times. I tried running away. The doctor came in the next day, and he told me I wouldn't be able to make it to the football game. They gave me a popsicle and a Sprite, and then I woke up and it's like January. I guess the decision was made that I get transferred down to the University of Iowa, where there's more of a specialty. They have more capabilities to care for somebody that was in my situation.
You think just the pancreas is going to be inflamed. Well, it's not. The pancreas is so close to your liver and your stomach and all sorts of other organs that it will inflame everything around it.
His particular pancreatitis was called necrotizing pancreatitis, which can carry a very high mortality rate. As a result of that, we needed to perform emergency surgery. He was fortunately able to recover, and then he presented to clinic for us to repair his incisional hernia, which measured about 25 centimeters by 40 centimeters in dimension, which is a very large incisional hernia. I think one of the things that sets us apart is that we have many fellowship-trained specialists, not only that can care for general surgery patients, but also for these patients with complex abdominal wall hernias.
When I had the hernia, I couldn't do any other activities, so I walked. I walked a lot. I walked at least 5 miles every day for 94 days. And the first day that I missed getting my 5 miles in was the day I had surgery. You know, there's a lot of couch time and hanging out with my dogs for the first week or so, but after that, I mean, everything, started just falling back into place. To stay active, I bike a lot. I try and bike at least 20 miles a day. In September, I did 400 miles. So I like to ride on the trail. It's a good stress reliever. I was deathly ill, and now I get up and I do whatever I set my mind to. When I think of the University of Iowa Hospital and Clinics, I think the first thing that comes to mind is miracle. I mean, for me, that's what happened. We live in an area that we're so fortunate to have this hospital here. There's nowhere else that I think that you're going to get the same success that you do here.